Hello, dear student. I hope you all are doing absolutely great. My name is Farooq Ahmed, and I welcome you all into our YouTube channel. So, in this whole series, what we will going to do, we will cover the whole pharmacology topic into different chapters and different segments. Along with that, we will try to cover some previous year question, which has been asked into the different pharmacist exam, or it could be asked into the DPAD or NIPER exams as well. So, in this today's series, actually, I'm going to cover the general pharmacology topic. Before I start this topic, I will let you know that this topic is very important to understand some basic concept of the pharmacology, which will be required to understand the whole upcoming new pharmacology series. Okay, so it is very essential to understand, as well as having the basic concept is very required. First of all, we have to understand what is mean by pharmacology. Pharmacology is derived from the two words, that is the pharmacon and logy, that means study. So pharmacon means basically the drug or medicine, and the logy means to study. To study. Okay. So the pharmacology, as I told, the pharmacology is derived from the two words, that is the pharmacon and the logy. Logy means to study, and pharmacon means the drug or medicine. So there is a slight difference between the drug and the medicine. Okay. So when we talk about a medicine is nothing but it is a complete pack from, like, when we mix the APIs, there is the active pharmaceutical ingredients along with the excipient and make it into the suitable dosage form. Then we call it as the medicine. And if it is only the API, if it is not included any kind of excipient, anything, so then we can call it as drug. Okay. And actually, the drug having this therapeutic activity, excipient is support to deliver into the suitable dosage form. Okay. So in this pharmacology subject, we will mostly cover about the drug, okay, not the medicine. So as per the WHO, we have the definition of drug, that any substance or article that modified or explore physiological system or pathological state, we call it as drug. So let's take an example of paracetamol. So when we have the fever, that means increasing the body temperature, we will take paracetamol, right? And what paracetamol actually does in our body is that it actually lowering the body temperature by making changes into the physiological system in our body. Okay. So then we consider the paracetamol as a drug. Okay. So the pharmacology is basically having two different branches, that is the pharmacokinetic and pharmacodynamic. Pharmacokinetic, the kinetic mean, what means the movement. Okay, movement. So kinetic means movement. So it refers that what body does the drug. So means that when we take the drug, so after taking the drug, what the body responds to the drug, that we call it as pharmacokinetics. So in this pharmacokinetic, we have different parameters like the absorption, distribution, metabolism, and excretion. Okay, these are the four different parameters that we have into the pharmacokinetic that we will cover into the upcoming lecture. Okay. And now we have the pharmacodynamic concept. So dynamic means power, right? Dynamic means power. So the power which is having into the drugs, basically that are going and showing the effect action to our body. So we call it as the pharmacodynamic parameters. Okay, so pharmacodynamic branch here we discuss about the what the drug does to the body. So you can correlate this D to this D. So first of all, pharmacodynamic means what the drug does to the body. Okay, now we have different segment, that is the pharmacotherapeutic. Pharmacotherapeutics means basically where basically the application of pharmacological information with the disease. like what is the disease state condition and what is actually the disease that are having the patient. So, and according to that, we will give the treatment. Okay. So that comes under the pharmacotherapeutic sector segment. Now, the clinical pharmacology. So you have to remember one thing very carefully, that is the clinical. When we talk about the clinical, any clinical study, any clinical trials, anything, so that should becomes under the human subject or the man is involved. Okay. So clinical pharmacology is nothing but the study of drug in the man. One more important thing is that I think you heard about the clinical research industry. So in clinical research, basically we will do the clinical trial. There are different phases of clinical trial is there. So all these clinical trials, the human subject is involved. That's why we will call it is clinical, right? So clinical pharmacology is basically the study of drug into man, or we can say the human. Okay. Now, what is the toxicology? Toxicology includes the study of adverse and the toxic effect of the drug. Okay, so adverse effect, we have the two response that is very, very essential for the pharmacovigilance sector. That is the adverse reaction and the adverse event. And the toxic effect, or we have one another terminology that is nothing but the side effect. So, what is the difference between the side effect and the toxic effect is that side effect is the unwanted effect that can occur into the normal dose. When the patient is taking the normal dose, then also there is some problem. So we call it as a side effect, and the toxic effect means when the unwanted effect is occurring by uh, taking the overdose of that medicine. These are all of these studies that comes under the toxicology study. Okay. And in this toxicology segment, we will cover later, because there is the vast topic that we have to cover into the adverse event. So next we have the chemotherapy segment. In this segment, we will basically talk about the treatment of the infectious disease or cancer. So there are different type of disease that caused by different type of microorganism. It could be by fungus, virus, or bacterial infection. So for that we have different treatment, right? And also for the cancer, we have the chemotherapy. There is different drugs which are involved. So all these treatments are comes under the chemotherapy. So here I have discussed few topics. I hope you understand. And later on the slide, I will cover few more topics which are remaining. Thank you.